the final diagnosis or the report which we actually give. Here the format, units, methodology. We've had a lot of discussion on all this. So this is very important that that report captures all this information. This is especially important when the patient is going to come back with the reports of 2 labs, because unless you know the comparative technologies, you're not going to be able to explain the differences to the patient. In fact, if by mistake when transcribing the reports, if you have not transcribed all the information from the referred lab properly, you may actually be denoting a technique which is never available also for that particular assay. So interpretations which the other lab gives you are also important. They have to be there, or your own interpretations or sample limitations have to be mentioned on the reports. If practice guidelines are being referred to, like say for example thyroid, we are putting in that we have taken this from the NACB guidelines, especially for the pregnancy, because these are changing every day and we also need to have some solid reference on the report for certain reference intervals. So it's basically important to know your immunoassay in terms of principle, specimen collection, analytical assay procedure, the calculation of results, the sensitivity and the range, the specificity, etc., etc. We've already discussed this the whole day. Now the question would be, where do I find all this information? Is it easy to find, difficult? Is there a free access to most of these sites? I'm sure that this would be a relevant question which would come to your minds at the moment, because where does one go and search for all this information sitting in a busy lab? Google is really an answer. I mean, I'm not saying that everything, the moment you put in a search, all the articles which will come up will be the authentic articles or will give you the correct information. But at the same time, most of the times I have seen through my own experience over the last 5 years, when I have tried to intensively study these immunoassays, that this basic search can guide you to most of the authentic websites. There is AACC, there's the NGSP program, there's westguard.com, CLI, Clean Lab Navigator, then of course the PubMed. So most Growth Hormone Research Society, then there is ADA, American Diabetes Association. So most of these sites will give all the information that we need. In fact, it's a surprise to see that most of the endocrine immunoassays are more discussed on the platforms of Endocrine Society, in the ADA, in American Diabetes Association, rather than pathology journals. So most of these are discussed on clinical platforms, and we get the information whenever we need it. And lastly but not the least, we have talked about common sense some time ago when we interpret all these assays. I would also talk about the human spirit, because through all this technological jargon that we have been hearing since morning, the basic passion and compassion to see to it that the reports that you release positively affect patient care is what would be the most important thing to do. Thank you.